this video, we're going to talk about hypersensitivity reactions. Hypersensitivity is an unwanted response. It is a hypersensitivity and oversensitivity. There are 4 types. The first type is usually an Ige mediated. It is what is commonly referred to as an allergic reaction. Let's take an example. This here is a normal non-allergic person. When he is exposed to any allergen like a bee sting or eating peanuts, his body is going to react by releasing Igg, and the body will respond normally to this allergen. Whereas an allergic or an atopic person is exposed to peanuts, his body is going to release Ige. So type 1 is Ige mediated. What will Ige do? Ige will cause mast cells, basophils, eosinophils to release histamine. Histamine is responsible for the allergic reaction. It's going to cause systemic changes like vasodilation and edema, bronchoconstriction, which is the case in asthmatic patients, or severe itching, which is usually seen with bee sting. Severe release of histamine may also cause low blood pressure and heart failure, which is known as an anaphylactic shock. The second type of hypersensitivity reaction is Igg and Igm mediated. They respond to tissue antigen. So for example, this here is your body tissue. The cells are displaying surface antigens. Now when an antibody, which is usually Igg or Igm, arrives, the Fc region is going to call leukocytes. The leukocytes is going to try to engulf the cell, but as the cells are a part of the tissue, the phagocytes cannot engulf it, leading to frustration. After the frustration of the phagocytes, they will release cytokines and activate the complement system. This is the case with many receptor autoimmune diseases like thyroid-stimulating hormone receptor in Graves' disease and diabetes, which attack insulin receptors in the pancreas. The third type is also Igg and Igm mediated. This type is called an immune complex. When an antigen and an antibody are bound together, this is called an immune complex. Now they are roaming freely within the bloodstream, and they will cause systemic problems when they are deposited. They can be deposited on heart valves, causing endocarditis, or in the synovial fluid of joints, causing arthritis, like the case of rheumatoid arthritis. They can also be deposited in the kidney, like post-streptococcal glomerulonephritis. This region, the Fc region, is what recruits leukocytes, and these leukocytes are going to release cytokines and activate the complement system. The fourth type is the only type that is cell-mediated immunity, so antibodies are not responsible here. Instead, T cells are responsible. Most importantly, T helper 1, which activates CD8, which later activate macrophages. This will result in cytokine-mediated inflammation. This often results in abnormal response like a granuloma formation, which is the case in sarcoidosis and tuberculosis diseases. Hypersensitivity reactions are the basic behind autoimmune disease. Thank you for watching.